Minister of Health, Dr. Lackram Bodoe, has requested a progress report on the implementation of recommendations following the neonatal deaths at the Port of Spain General Hospital's Neonatal Intensive Care Unit last year. The recommendations were made by a committee from the Pan American Health Organization, which investigated the incident. The investigation was ordered by the former Health Minister Terence Dialsing after the deaths of 7 babies due to a bacterial infection at the Port of Spain NICU between April 4th and 9th in 2024. Parents outside of the cluster stepped forward at that time, claiming that their infants also died because of negligence by staff at 2 other regional health authorities.
The recommendations that were made by the PAHO committee that investigated that incident in April of last year, how many have been implemented, and where we are in terms of, getting the NICU units up to standard.
Minister Bodoe also confirmed that an investigation is underway into an incident involving a newborn who reportedly suffered a broken arm during delivery at the Mount Hope Maternity Hospital. The incident, which initially circulated on social media and in news reports, was believed by some to have occurred recently. However, Dr. Bodoe said that the incident may have occurred last month.
Happened in April. So I do have a preliminary report. So first of all, I want to express my sympathy to the parent of that child. So I've asked for a full investigation into the matter. But of course, it goes without saying that as the Minister of Health, we are very concerned about maternal and child health. And of course, myself and the Minister will be visiting all of the facilities. I believe Minister Mount Hope Maternity Hospital will be on the list of facilities that we intend to visit.
The minister was speaking to the media at the ministry's Mosquito Awareness Week outreach campaign at Gulf City Mall on Friday. Minister of Health, Dr. Lackram Bodoe, says a full assessment of the Couva Hospital is currently underway following a recent tour of the facility. The findings are expected to inform the next steps in making the hospital fully functional. He added that the report is expected to be submitted soon to the Prime Minister.
Informative. I am still awaiting a report, and the purpose of the tour was to do an assessment of the assets that are there and to do a gap analysis of what is required to make the hospital fully operational. Our preliminary findings were that there were 20 patients, I believe, in the 230-bed hospital. Of course, that is far from satisfactory. There was also the issue of non-functional CT scan and MRI machine.
The minister noted some preliminary concerns observed during the tour.
Of the government to make sure that the hospital is fully operationalized in the shortest possible time, but at this point I'm not able to give a starting date as to how we go forward.
When do you expect to get that report?
That report should be on my desk by Monday.